Hello, I'm just a relative, and I'm here just to talk about a failure. A failure of care for my mum that has left her broken. I speak today on her behalf, on behalf of my brother, and on behalf of my mum's many friends. But first, let me tell you about her. Now 91 years old, she started her working life as a nurse when everyone told her she should just stay at home and have a family. Against her parents' wishes, she qualified as an SRN and started her nursing career working in theatre at the John Radcliffe. She then went on to look after the prostitutes of Oxford, the least popular job in the hospital at the time. Later, she looked after the rich kids and the poor kids. Everyone was the same to her, because nursing, caring, was everything to her. My mum brought up two adopted, unwanted kids, gave them a home and the best upbringing anyone could have hoped for. I'm one of those kids. Then, aged 89, she needed care herself. When Thomas took her in with a periprosthetic hip fracture, nobody could have predicted the scale of neglect she would have to endure. Before my mum entered your care, she could shop for herself, she could cook for herself, and, on a good day, finish the easy crossword in the Times. No longer. When you initially discharged my mum to rehab, she had appalling bedsores. One so deep it had led to osteomyelitis. A wound so bad that the GP who examined her on admission at rehab said she could smell the flesh rotting. Rotting. And yet there was no mention of this on the discharge note. No antibiotics, no painkillers. And that discharge note signed by a doctor who hadn't worked for the trust in weeks. As a failed discharge, she was immediately returned to your care, and she spent the next 9 weeks on her back in an acute ward as you tried to heal the wounds with a back pump that only occasionally worked. Yet, before her final discharge, I had raised concerns about her bedsores on multiple occasions, both on the wards and in writing. I was assured I had nothing to worry about. It was being taken care of. I corresponded with two of your most high-profile consultants and one of your most high-profile nurses. But you know what? Nobody examined my mum. She was reviewed on paper, sure, but there is no record of any doctor examining those wounds. No one. Other than the TBNs treating the wounds. Your first investigation, when it eventually came, essentially blamed those nurses, blamed the process and blamed the technology. But there was nothing in that report about a holistic approach to her care, where clearly there were wider failures. Only the second investigation showed the true extent of the failure of individual doctors, of medical teams, and of processes for what it was. Nothing less than a total failure of care. Now, I will always feel guilty that I trusted your consultants to examine my mum. You took an elderly lady who was still living her best life at home and you broke her. You literally broke her. I'm currently sitting in my mum's bedroom, but you'll notice she isn't here. She's now in a care home, double incontinent, still with the wound that your neglect was responsible for, living with the level of cognitive and physical deterioration you would expect from 9 weeks on your back at her age. If only a doctor or senior nurse had examined her wounds after the surgeon alerted the system, then you would not have broken her. You would not have destroyed her last few years of active life. It's too late for you to help my mum, but not for others who need your help. On every ward in your hospital, you have patients right now who do not have anyone to fight for their health, to advocate for their needs. Patients who need your protection and your care. And these are the people I want to protect. I am always going to carry the guilt of your neglect of my mum. But in truth, we, those who love this remarkable woman, we could not have done more for her. We told you there was a problem multiple times. You could have done more. I hope what you learn from this case study changes not just the processes, but the behaviour of those who could not be bothered to examine an elderly, vulnerable patient. Thank you for listening.